Some of self-defense I teach is Krav Maga, which is the Israeli hand-to-hand combat system.
Fierce moves to disarm an attacker.
I was very flexible, was able to do all this, and had been teaching for about 20 years.
Even when the cartilage in his hip was down to nothing.
Pain in the left hip. They said, yeah, you pretty much have bone on bone.
Gus Botazzi powered on in pain.
I would teach 8 to 10 hours in a day.
Until he couldn't.
Kind of fell off a cliff. Everything just kind of went bad, and I got more and more severe, and actually took to getting a walking stick so that I could actually move around with some support.
What would it take to get this martial arts pro back to peak performance?
We actually take a titanium stem that looks something like this, and it's inserted directly inside. And then on top of this titanium stem, we're placing a ceramic ball. Ceramic is the smoothest material that we have in orthopedics. And therefore, the thought there is that it will provide the least amount of wear onto the plastic cup. And so when the hip comes back together, you have a new ball and cup joint that as it's moving, there's nowhere where the bones can rub together. There's no bone spurs that can limit the range of motion. Total hip replacement to get to the hip to do the surgery. I tend to use what's called the anterior approach.
Unlike other more traditional techniques, ONS surgeon Dr. Jonathan Berliner says this one does not entail removing muscle from the bone, which makes recovery faster.
But you can see that there's really a good amount of motion and mobility that they would have.
Let's test it out. Gus, how's the new hip doing?
Performing that level of activity at 2 to 3 weeks after the operation was surprising for me. And like I told him, that is not the norm. I think the take-home message is that the recoveries these days are faster. Even within 4 to 6 weeks, patients feel completely independent, doing almost all of their normal activities.
For this patient, new hip, new appreciation for life with his students, friends, and family.
My fiance can't believe that she's watching me walk my dog, go up and down the stairs. Without thinking about it, I'll even run with my dog. It's very liberating, a lot of fun.
I'm health reporter Gillian Nath, and that's your News 12 Health Report.